Hello, my name's Rowena and I'm the Carers Advocate for LAMP. I just thought I'd give you a bit of a lowdown on what my job entails and what I do on a daily basis. So at the moment, obviously during lockdown, things have had to change a bit with our organisation. And one of the things I do is run monthly carers groups in 5 locations across Leicestershire and Rutland. Obviously, we can't have those monthly groups in person with people at the moment. So we're running a Zoom weekly carers group, which is through like a video conferencing link online. And that seems to be working quite well for a lot of our carers at the moment. And it's actually bringing them together from different parts of Leicestershire and Rutland. And they're sharing their experiences and some of the challenges they're facing, but also some of the achievements that they're going through at the moment. The other thing I tend to do is phone around anyway regularly to the carers just to see how they're getting on. And one of the key things a lot of them are finding at the moment is that they are quite socially isolated, and the person they're cared for, if they're housebound as well, that's even more difficult for them at this time. So I've been signposting them to services that can help with running errands, picking up medication, picking up shopping, and delivering food parcels. Also helping those carers who may have loved ones that maybe are in hospital, that have been in a domestic abuse situation at home, and making sure they're getting the support when they come away from hospital. And there's organisations that can help those who are going through domestic abuse, so referring them to those organisations. Also, there may be a carer who has a loved one with quite a serious mental health condition who just needs someone to talk to listen to, going through difficulties, and feeling quite cut off obviously at the moment. So that's another area I would help with. And some of the carers are feeling perhaps this time that the person they care for, the carer that may come in from an agency, may not perhaps be wearing the PPE equipment. Sometimes they've been given confusing information. So it's sort of speaking to them, getting that clear, and then passing that information back to adult social services, so it can be picked up and dealt with, and that they feel then that their needs are getting met. So that's a lot of what my job entails, and we have become quite busy just lately. So obviously with the current situation in lockdown and people feeling more cut off. But there's positives coming out of it. The weekly groups are running really well, and a lot of the carers are now involved in making things, arts and crafts, that we can use back at the office, with things like painted stones, that we can put out with messages of hope to other carers and other service users that come into our organisation. So yeah, that's what we're doing at the moment mainly. Okay, thank you.